pronouns, and I'll be your host for some meeting logistics. As you can hear, the meeting is being recorded. Closed captioning is available. You may access the closed captioning by clicking the CC button at the bottom of your screen. We ask, next slide, please, Jenny. We ask that you use the Zoom raise hand or chat feature if you want to share a comment. Let's see, can we move the slide to the next one before oh, there we go, thanks. Only the hosts will be able to see the chat comments. Both the raise hand feature and the chat buttons can also be found at the bottom of your screen. We'll call your name and you may unmute yourself when it's time for you to share your comments. Please speak clearly and limit your comments to 5 minutes so that we may have time to hear from everyone this evening. Unless you're speaking, we ask that you please turn off your camera to help with our bandwidth issues, prevent bandwidth issues tonight. And also screen sharing is not allowed. If you have documents or materials to share, please email them to hcmo.info@oha.oregon.gov. And we'll put that email address in the chat. And at the end of the presentation portion, we will discuss how to share additional public comments via email. Next, we'll review the purpose of this session with the next slide, please. The reason we're here this afternoon is for informational purposes only. OHA will use what we hear to inform our review of Care Oregon and SCAN Group deal. Today, OHA staff will provide some high-level information about the planned deal and the review process. We'd like to hear from members, providers, community organizations that may be affected by this deal. OHA's role today is to listen and gather information. We won't be responding to questions. If needed, we can follow up to respond in writing. And after the brief presentation, we'll dedicate the rest of the time to hearing from the public. We'll stay on the meeting until the end, which is at 6 p.m. this evening, even if there are no additional commenters. We'll do our best to get to everyone, and the recording of this listening session, as well as this morning's listening session, will be posted on our website. And now I'll turn it over to the Healthcare Market Oversight Program staff.
Thanks, Suzanne. Hello, my name is Stacy DeLong. I work for the Oregon Health Authority with the Healthcare Market Oversight Program. And I'm going to talk a little bit about the program. I'm going to provide some information about the transaction, and then I'm going to talk about some of the next steps. So we'll start with some information about the Oregon Health Authority's review of Care Oregon's plans to combine with SCAN Group. In 2021, the Oregon legislature passed House Bill 2362 to oversee healthcare consolidation. This bill created the Healthcare Market Oversight Program, or HCMO, as we often call it, and the program launched in March of 2022. So through the Healthcare Market Oversight Program, the Oregon Health Authority reviews healthcare business deals, such as mergers and acquisitions, to make sure they don't harm people or communities in Oregon. If a healthcare company is planning a deal that meets the requirements for a HCMO review, the company will submit a notice to OHA, and then OHA reviews the deal to understand how it might affect people in Oregon. Next slide, please. So healthcare market oversight is concerned with business deals that involve healthcare entities. For the purposes of our program, when we're talking about a healthcare entity, we're talking about companies that provide healthcare. This includes doctors' offices, hospitals, health plans. We include companies that help administer healthcare, such as management services organizations. And it also includes companies that might have control over a healthcare company. And this sometimes is like private equity firms. Next slide, please. When we're conducting a review, HCMO looks at how the transaction could affect healthcare costs, including the cost for consumers and purchasers, access to care, including the availability of services and providers, quality of care, such as how it will impact health outcomes, and health equity, including how the transaction might exacerbate or address existing inequities. Next slide, please. So when OHA is reviewing a transaction, after reviewing, will issue a decision or a recommendation. So for each proposed transaction that we review, we can approve, and our approval means that the transaction can move forward as planned. We may approve with conditions, and conditions may include things like requirements that the companies maintain existing service levels or continue to serve certain populations. Another option is disapproval, which would prevent the transaction from moving forward as planned. So for deals that involve a health plan, OHA may provide a recommendation to DCBS, which is the Department of Consumer and Business Services. DCBS regulates health insurers. And when DCBS is also reviewing a transaction, it means that HCMO doesn't issue our own formal order or decision. DCBS instead has the final say. This is the case for this transaction for the Care Oregon and SCAN deal. So HCMO will be providing a recommendation to DCBS once we've completed our review. Next slide, please. So I'll talk a little bit about how we assess impact when we're doing a review. So we do business and policy research, which involves looking at the terms and conditions of the business deal, what are the planned activities of the business, what laws and regulations apply in this case, and how similar deals have impacted healthcare in other states or even in Oregon. We collect public input. Public input could include public comment, which we get for all of our reviews. This listening session is an example of getting public input for a transaction. And in some cases, we may work with a community review board to understand the effects of the deal. We also analyze data. We'll use data that's provided from the companies that are party to the transaction, from public sources, and from state agency databases to understand how these companies currently perform and what the deal might change about how they're performing. Next slide, please. Okay, now I'm going to provide a little bit of background information about Care Oregon and SCAN's plan transaction. This information is intended for informational purposes only. It's a very high-level overview. We've got a lot more materials and information on our website related to this transaction, and I encourage you, if you want to know more, that's a great place to look. Okay, next slide. So Care Oregon is an Oregon nonprofit company that provides health insurance benefits to more than 500,000 Oregon health plan members. Care Oregon's primary business is from public programs like the Oregon Health Plan and Medicaid. Next slide. Care Oregon has a number of affiliated companies, including coordinated care organizations, or CCOs. Coordinated care organizations are regional entities that provide benefits to Oregon health plan members and maintain networks of providers. Care Oregon operates Columbia Pacific CCO and Jackson Care Connect CCO, and Columbia Pacific is serving OHP members in Clatsop, Columbia, and Tillamook counties, and Jackson Care Connect serves OHP members in Jackson County. Care Oregon is also affiliated with HealthShare of Oregon. And HealthShare is serving members in Clackamas, Multnomah, and Washington counties. Care Oregon's relationship to HealthShare is a little different from its relationship to the other CCOs listed here. Care Oregon is one of several plans that serves HealthShare members, and Care Oregon also provides administrative and operations support to HealthShare. Care Oregon also operates a Medicare Advantage plan for members who have both Medicaid and Medicare coverage, and operates a home health business as well. Next slide. Okay, so I'll talk a little bit about SCAN Group. SCAN Group is a California nonprofit company that serves older adults. SCAN serves about 270,000 people across multiple states, and their primary business is Medicare Advantage plans. Next slide. SCAN offers plans in California, Arizona, Nevada, and Texas, and also standing up plans in New Mexico. And SCAN also operates medical provider groups and services for older adults and people with unstable housing. Okay, so I'm going to talk a little bit about what is the terms for this transaction. So SCAN and Care Oregon are planning to combine. Under their proposed transaction, SCAN and Care Oregon plan to create an organization that will serve Medicare and Medicaid members across multiple states. SCAN Group will be renamed HealthRight in the planned transaction. HealthRight plans to become the parent company of Care Oregon. Care Oregon will pay SCAN Group $120 million to become a subsidiary of HealthRight, And Care Oregon will contribute $25 million to launch a charitable foundation to serve the needs of Oregonians. Next slide. What will this new company do? So HealthRight will include a Medicaid division, which will be led by Care Oregon's president and CEO, and that will focus on expanding Medicaid plans. SCAN and Care Oregon say that combining will allow them to compete with large for-profit insurance companies and provide new services. And Care Oregon has stated that it does not anticipate any changes to current services in Oregon and plans to keep current management and staffing. Okay. So let's talk about what's next for this transaction review. Next slide. There we go. So multiple state regulators are reviewing this deal. So there's separate regulatory processes, and each of these processes is governed by different laws and different administrative rules. This slide provides a really high-level summary of these reviews. Again, we have more information on our website, so I encourage you to go there if you want to know more about these. The three main reviews that this transaction is subject to is the Healthcare Market Oversight Review, which we've just discussed. There's also an Oregon Health Authority CCO Form A review, and that is really looking at alignment with CCO requirements, leadership, control and governance, competition, equity, cost, and quality. Separately, there is the Department of Consumer and Business Services Domestic Insurer Form A review, and that's looking at alignment with legal requirements, financial conditions, leadership, control, governance, and competition. There is some overlap in what the various reviews cover. Each review might be looking at similar issues, but applies its own lens. Next slide. Okay, so this is a diagram shows a little bit of the process of what's going to happen next for this review. So once HCMO's review is complete, we'll publish a report and send a recommendation letter to DCBS. DCBS is doing its own review and will incorporate HCMO's recommendation, and DCBS will issue a decision. Separately, OHA's CCO Form A process will conduct a review and issue a decision. If both DCBS and Form A approve, the transaction can proceed. If either disapproves, the transaction cannot proceed as planned. A lot of factors go into the timeline for these reviews. We are aiming to complete the HCMO review in the next several months. Next slide. Okay, so this has some information about how to stay informed. If you want to get updates about this transaction or any other work that HCMO is doing, you can sign up to receive email updates. Our website, as I mentioned, has a bunch of information about our current transactions and how our program works. And then you are welcome to email questions, thoughts, public comments to hcmo.info@oha.oregon.gov. And now I am going to pass it back to Suzanne for the next section.
Hey, thank you, Stacy. Next slide, please. Okay, so why are we here? We're here today because we want to hear from the community. We want to hear from community members, providers, community organizations that may be impacted by this deal. Do you have hopes or concerns about the deal? Do you support or oppose the deal? Have you had experiences with Care Oregon or one of its coordinated care organizations? What would you want to see from the proposed new company, HealthRight? How would the deal impact you or your community? How would the deal impact your access to care? And next slide, please. Just as a reminder again, today's session is about hearing public comments, but you can also submit a written comment to hcmo.info@oha.oregon.gov with your thoughts about this deal. Please mention Care Oregon in your message. Written public comments may be used in reports and publications, and maybe written public comments will also be posted to OHA's website, so please don't include any sensitive or confidential information for that reason. And next slide. Now it's time to open up for public comment. But before we do, we want to remind you that today OHA is here to listen. This means that we won't respond to what you share, nor will we attempt to fix or resolve the question or concern that you bring today. Even though we're not responding today, we will be considering your comments in our review. We will not correct inaccurate statements that are shared as fact. We will, however, listen with careful attention, respect, and the honor that you deserve. Any public testimony is meant to provide a voice and a perspective from that individual and is not a representation of the Oregon Health Authority. Comments may be used in OHA's reports and publications. And as a reminder, public commenters are welcome to share your video while you're presenting your public comment, but please keep your video off for the remainder of the meeting to help reduce bandwidth capacity issues. And we have guidelines and rules provided for providing public comment on our website. And Zachary's pasted a link in the chat. And now we'll turn it over to public comment. So again, if you want to use the raise hand button at the bottom of your screen, feel free, and we will call on you to unmute yourself. Or you are also welcome to put chats in, and the host will either read your chat or call on you to present your public comment. Okay, I see Tom. Go ahead.
Okay, finally unmuted. Okay, thank you very much for the opportunity again. For those that weren't there earlier, I did comment earlier and I submitted public comment. My name is Tom Simpson. I'm a retired nurse practitioner, and I'm here entirely on a volunteer capacity, speaking for myself and as a former Multnomah County nurse practitioner who has known Care Oregon since its inception in 1993. And I just want to add a couple comments to my previous comments from this morning, because I've learned more in the course of the day. And I have just a couple of questions. One is, but I would also, just as I put something in the chat to say, in the interest of transparency, it would be nice if the people are on the call would identify whether they work for one of these organizations of interest or one of the subsidiaries, so we can see in full transparency who's involved when coming onto this meeting, who's observing, who's commenting. I think that would be very, very important. One of the things I want to do, I looked further at the org chart for the future org chart, and with a structure of health right at the top and Care Oregon underneath that, I don't know. In the world of not-for-profits, I don't think there's anything that keeps the parent company from dissolving the subsidiary under that at any point and taking out Care Oregon as the middle person. And I think that is potentially problematic. So, will there be some guarantee that that would never happen? And then another comment I'd like to add is that let's see, I want to know, you mentioned 125 million to Health Right and 25 for a foundation. What is happening to the other $800 million? These dollars belong not to Care Oregon, they belong to the community. These are brought in by the community for care and to take guard of for services to Oregon. So the idea that Care Oregon in any way or Health Right could take control of all these dollars just isn't right. The money belongs to the community, and where is the guarantee that every one of those dollars will stay in Oregon? And then finally, I know, again, the issue of transparency. I mentioned earlier about the issue that Optum has a contract with Care Oregon, Optum being a subsidiary of the world's largest insurer, United Healthcare. And I think that's problematic. And we know that with inside the Care Oregon structure, there are previous United Healthcare employees, at least one employee in a significant position. And I think that has to be called out. You know, how do we have a former United Healthcare employee sitting inside of Care Oregon? You know, what role will they play in this decision making? So those are my comments. I'm hoping we hear from other people. Thank you very much.
Thank you very much for your comment. We appreciate you being here. We'll open it up again for others who would like to raise their hand or put a comment in the chat to speak and share their comments. Lori, go ahead.
So I may have missed something the first few minutes signing on, but I wanted to know specifically what additional services would be available to Jackson Care Connect members in Southern Oregon with this merger.
Thank you for that question, Lori. As a reminder, OHA, the purpose of today's listening session is just to listen to comments from the public. Information regarding the merger can be found on the website.
Okay, so I'll make a comment then. I'm sorry for just asking a question.
No, sure, I understand. Go ahead.
So I work as a nurse practitioner at La Clinica in Southern Oregon. We have a lot of Jackson Care Connect members, and it's very difficult at times when things change with what's covered, what's not, what providers accepted. We've had members, who have had to disconnect from our clinic because of changes that happened. And my concern with this larger organization is how can we be totally confident that we won't have additional complexities with the larger organization and being able to control locally our specific needs within our community, working with the local HMOs and other clinics and services in our area. The local nonprofits.
Thank you, Lori, for your comment. There's another opportunity for people to raise their hand or put a comment in the chat. If you'd like to add something, please feel free. Michael Klein, go ahead.
Thank you. My name is Michael. I am a therapist in Southern Oregon, and I've had a lot of close interactions with Jackson Care Connect with care coordination. One of the things I really appreciate about the agency is the autonomy that they often have is to support the local needs. And one of my major concerns about this merger is how that's going to affect the individual CCOs that are part of this Care Oregon chain of being able to enact policy change or implement new kind of programs and that sort of thing that are specific for the region. Here in Southern Oregon, we often have very specific needs that are kind of unique to our region. We're pretty rural with a diverse population, and that's kind of different to Portland, and I would imagine that's different than California as well. So one of my biggest concerns with this merger would be that piece.
Thank you. We appreciate you sharing. Jenny, can we go back to slide 22? Thanks. Again, the purpose today is to hear from the public on question or hopes and concerns about the deal between Care Oregon and Scan Group. Please feel free to raise your hand or put a comment in the chat if you'd like to share. Thank you. Read the questions again in case it spurs some thoughts of people might want to share. We're here today to hear from community members, providers, community organizations, and questions you might want to share. Or do you have hopes or concerns about the deal? Do you support or oppose the deal? Have you had experiences with Care Oregon or one of its coordinated care organizations? What would you like to see from the proposed new company, HealthRight? How would the deal impact you or your community? How would the deal impact your access to care? Feel free, if you'd like to share a comment, to raise your hand. There we go. James, go ahead.
All right, I have actually a couple of comments. I know when Care Oregon started doing Advantage plans and such, we started running into a lot of prior authorizations and a whole bunch of red tape like that. One of my concerns would be is, oh no, here we're going to have more red tape to contend with. And it's hard enough with some of the senior and disabled persons in our area, Jackson Care Connect, Southern Oregon, getting those services, the communications established. Is there going to have more problems with red tape? Are we going to have more problems with communication issues, especially now that we're starting to open up the communication with the deaf population, for example? That would be one of my concerns. And another one would be, are they going to, is Healthline going to connect with the local advocacy committees and the local partners and let us know what their plans are for our area?
James, could you please just state your name and your affiliation for the record?
Oh, my name's James Nagel. I'm just here for my own information. However, I am on an advisory group. It's called the Disabilities Advisory, um, Advisory Council, excuse me. So, but I was here just as a person wanting to know what was going on.
Thank you. Do you appreciate your comments this evening? Those of you just joining, we're welcoming comments by raising your hand or commenting in the chat. We'll ask you to state your name and if you're affiliated with Care Oregon or SCAN. And we are here until 6 p.m. So please feel free to share your comments. Thank you. Mary Beth Healy, go ahead.
Hey there, thanks. This might be a dumb question, but I am just curious about this. Just seems to have come come out of the blue, I feel like, for a lot of folks. So I'm just, thank you. I see the chat is now responding to my chat question, but just like, what is the timeline? How, how can consumers learn about this and know how to let OHA and others know how they feel? There's been a couple of press articles, but like I just don't, I don't understand what the timeline and opportunity for, frankly, for stopping this might be for Oregonians.
Thanks, Mary Beth. I will post a couple links in the chat with more information, including the email address where you can send written comments. There's earlier slides in this presentation that go into a little more detail, but we're anticipating that the healthcare market oversight review will complete in the next several months. There's a couple other reviews that are also happening of this transaction. They have their own timelines, and so there will be opportunities for input through those processes as well. And you are welcome to email us or sign up for our distribution list if you want to get updates about this, and we will be sending out updates when we complete the review or when we have any other calls for public input.
Great. And do you anticipate that would happen after kind of internal review, as it were?
We are accepting public comment for the entire duration of our review period.
Got it. That's super helpful. And I assumed this was kind of a stupid question and that it had been covered, but I was running a little late, so I do apologize if it was redundant for folks. But thank you, appreciate that.
No worries. We had multiple people join late, so good refresher to revisit it. Thank you.
We appreciate the comments. For those of you just joining. Oh, go ahead, Lori.
I guess I'm having a bit of difficulty with this format because this feels very pro forma to me. Like, so you're hearing our fears, but there's no interaction that's giving us information. And it feels like, how do we get that type of information? Looking at the website, it doesn't look like the information's there. Maybe I need to spend more time at it. But is there going to be a time when we can actually have some discussion about this? Because it just feels awkward to be voicing our fears without any way to get reassurance or information.
Thank you, Lori. I appreciate the comments. We do have the information that we're able to share with the public posted on our website. And we do invite you to send us an email if you have more information that you'd like to share or questions that you'd like to ask.
Thank you for that feedback, Lori. Today is really just a listening session for us to collect input, but it's helpful to know that you would like different types of engagement. So we will take that back.
On Santa, go ahead.
Well, I'm just thinking in the spirit of interaction. I hear Lori's statement, and actually Lori and others, there is a lot of information on the HCMO website. Stacy, I don't know if it's possible to bring up the page that has the list of all the information that's there. The Care Oregon made the first step in December of last year when it submitted a application, if you will, describing what it intended to do. Then in January, there was a process where HCMO did an initial review, basically focused on whether they should go ahead and okay it or do a more extensive review. There were public comments. At the top of the list of things are those public comments, so you can read read those. Then along the way since then, HCMO has been sending questions to Care Oregon and to SCAN, and there are multiple documents in which they respond to those questions. Now, these documents are written by lawyers for the most part, I believe. It challenges at least my attention span to wade through them, but they are there. There are a set of recent comments that they have posted, which I think kind of broaden your chance to get opinions about the transaction. There are a lot of documents there, but when and if you wade into them, you should probably put aside a significant amount of time because given the size of this transaction and all the issues involved, there's a lot of information there. So this session is kind of unique, isn't it? But I just want to make sure you know that there is a lot of information, and to HCMO's credit, they want to stay kind of neutral and just hear from everybody, and I think that's what they're trying to do.
Thank you, Dr. Santa. Could you please state your name and affiliation for the record? Thanks.
I'm sorry. I'm John Santa. I'm a retired clinician and health administrator. Thank you, Suzanne, for that reminder.
No problem. Thank you. Appreciate the comments. I also want to point out Zachary has posted the executive summary of this proposed transaction and a link to the PDF document that's available on our website. And I thought I saw another hand, but it's gone. So maybe I didn't. Again, we welcome any and all comments. Please feel free to raise your hand or type something in the chat and we will call on you. Thank you. For those of you just joining, we're Opening the floor to public comments, please feel free to raise your hand or send a chat to the host and we'll call on you to share. John Santa, go ahead.
Yeah, John Santa, again, retired physician and health administrator. And I'll just use a few minutes. I think I have a few minutes left. I do oppose the transaction and am concerned about a number of aspects that I will submit in written. I've been through a lot of these transactions, probably 15 or 20 health insurance mergers, acquisitions, or delivery system mergers, acquisitions. Again, when it comes to information, it can be really challenging. I mean, you will look at the information that you see there and portions of it will be blacked out because the participants feel that the state is asking for information that's confidential or proprietary. And that's very frustrating. Many of these deals, if you will, end up with folks having to sign confidentiality agreements, and those agreements can be very punishing. So they're prohibited from speaking or saying anything. So by the very nature of these arrangements, there's a lot of secrecy that you have to overcome, and I think especially in a situation like this, it makes it really difficult when there's so many lives that are involved here. It makes it really difficult. It's really difficult, and I'm hoping that in the review, HCMO will be able to simplify where's the money going, coming from, committed to, not committed to, under whose control. You know, I'm hopeful that there's an organizational chart there for Health Right that's one of the more complicated organizational charts you'll ever see. I think very difficult for the public to look at that and really make sense of what's going on. And Health Right itself is a very tricky organization. For example, I was reading about the audit committee and the importance of the audit committee at Health Right. You know, the problem is that's buried in one of these documents at about page 10 or 12 or something like that. And so, you know, just the nature of this is such that, you know, lawyers can figure it out probably, but for the rest of us, it's a challenge. But in this case, I would urge folks to spend the time to do that, because this is important in a variety of different ways. I'll end there and just thank the folks who've come on the call for being here, and hope that you spread the word that this one's worth watching. As someone said, but I'll say to the contrary, this ship has not left the harbor. And it's important that you know, folks weigh in before that could happen. Thanks.
Thank you. We very much appreciate all the comments that we've heard this evening and this morning thus far. And as a reminder, we'll be using the comments to inform our review. I see another hand up. Tom, go ahead.
Thanks again, but John made me think about something, and particularly that org chart that I had also mentioned earlier. And it would be nice, be clear, you know, again, the general public, what is an LLC? What is the not-for-profit? And then somewhere buried in there, there's actually a stock held company, even though I believe it's like one person owns the stock. And so explaining that, like, what are these entities? Who has a say in these entities? Is all going to be really, really important in order for the public to understand and comment going forward. So that would be my comment in terms of adding to explanatory statements to what each of those entities actually are and who's in charge of those in that complex post-merger proposal. Thank you.
Thank you. Happy to solicit other comments, input. Feel free to raise your hand or send a chat to the host. Mr. Nagel, go ahead. And as a reminder, if you could please state your name and your affiliation before making your comment. And you're still on mute, James.
Oh, my name's James Nagel. I'm a consumer of Care Oregon services, as well on a Disability Services Advisory Council. And one of my bigger concerns here would be, as kind of was stated, is that right now, Care Oregon is listening to both the consumers in Oregon, our representatives in Oregon, and are subject to some of the state advisory councils and rules. Once it goes over to Healthline and it's California based, does Oregon lose all its power to what their ultimate decisions are?
Thank you for that comment. We appreciate it. Again, I encourage others to raise your hand or comment in the chat if you'd like to share some information with us today. For the purposes of those who are just joining, since it's after 5 and we might have some people joining us on after work, just to review, the purpose of today is to hear from members, providers, community organizations that might be affected by this deal. And OHA's role is to listen and gather information to inform our review of the Care Oregon Scan Group deal. And we'd love to hear from anyone if they have opinions on, if you have hopes or concerns about the deal. Do you support or oppose the deal? Have you had experiences with Care Oregon or one of its care coordination organizations, coordinated care organizations? What would you want to see from the proposed new company, HealthRight? How would the deal impact you or your community? How would the deal impact your access to care? Feel free to raise your hand or share a comment in the chat and we will call on you. Thank you. And in addition, for those of you who are just joining, there was a basic presentation given at the beginning of this listening session by the HCMO staff regarding the summary of what's been done so far and the deal and the process. Zachary's going to put a link to that presentation, the slides that were shared here in the chat, if you're interested in reviewing those and you have any comments you'd like to share if you missed it. Also remind people that the recording of this listening session and the public listening session from this morning will be posted on HCMO's website as well. And again, for those of you just joining, if you'd like to make a comment, please feel free to raise your hand using the raise hand feature or the chat feature to send a comment to the host, and we'll call your name. Thank you. welcome to those of you just joining. We have opened the floor up for public comments. If you'd like to share one, feel free to use the chat feature or the raise hand feature at the bottom of your screen. Chats go directly to the host, and if you'd like to share a comment, you're welcome to raise your hand and we'll call on you to share your public comment. Thank you. Again, I just want to reiterate, especially for people just joining, that the purpose of tonight's listening session is to hear public comments to inform our review of the Care Oregon and Scan Group deal. And there's a couple of different opportunities for sharing your comments. You're welcome to raise your hand and share out verbally, or you're also welcome to send a chat to the hosts, and that will go directly to the HCMO staff who can consider your comment in our review. And all comments today and received this morning will be considered as part of our review process. And we're really grateful for hearing all the voices and the input that we've received thus far. And there's also an opportunity to send an email to HCMO and you can do that by sending an email to hcmo.info@oha.oregon.gov and put Care Oregon in the subject line of your email and let us know your thoughts. Thank you. Go ahead, Charles. We can't yet hear you, but I think you're unmuted.
Can you hear me now?
Yes, we can. Thank you.
Okay, that it was not an ad for a cellular phone service. My name's Charles Gallia. I worked with the Oregon Health Authority for a number of years as a research and evaluation manager, as well as a senior policy advisor that oversaw some of the reporting that went to the federal government, CMS, about the performance of the Oregon Health Plan. In my capacity at the Oregon Health Authority, one of the things that I was responsible for was the evaluating the financial solvency of the organizations that reported to OHA, as well as the quality metrics, consumer assessment of health plans and systems, so the feedback that went there. I joined the Oregon Health Authority shortly after 2000, and as the Oregon Health Plan was going through a couple of transformations. One of the things that occurred shortly before I came on board was that there was this large multi-state organization, that insurance company that was overseeing much of the state. And with their departure, it left the Oregon Health Plan in a kind of vulnerable position where certain systems were collapsing because they weren't institutionally supported. And then that kind of gave rise to the local provider organizations in some parts of the state and others to rally together to say that we can do this differently, a kind of Oregon way. And what was exciting at the time was that there was these managed care organizations were pretty novel. They were novel at the federal level, and they were still that because they were skeptical about converting from a fee-for-service basis to something that was more oriented towards managed care. This evolution to the coordinated care organizations took it one step further, and that was with things like the introduction of the patient-centered medical homes, the community-based services, and the community advisory councils that were required of the managed care organizations. That bringing the healthcare services back to the local level was one of the things that was exciting to the federal governments that granted us the permission that we needed to move the Oregon Health Plan down the road. The result was a considerable savings both to the federal government as well as the state in terms of expenditures, because these organizations had a long-term commitment to the health and well-being of the communities. That reinvestment notion is key to the success of the Oregon Health Plan moving forward. The community orientation is also a key to moving forward. Community well-being and community orientations are not something that can be handled by outsourcing or moving our expenditures and revenue outside of the state. And so I hope that it's clear that I think that this move is actually dismantling something that has taken decades to do. Understanding and having stable relationships with providers is not something that can be renegotiated on an annual basis. Care Oregon was always held up as a model of how to do things right. They were some of the first providers to go engage in the community with social workers that would try to address the needs of people who are chronically homeless and actually save money for themselves as well as the state by diverting people from emergency rooms. Those premiums didn't go up like they did nationally because of the efforts that were locally faced. When I mentioned that I was part of the financial solvency evaluations, what I also noticed is that some of the entities that were multi-state used resources from one part of their organization to offset losses in another. It was almost like a predatory practice where that you could move into a market, underprice what you were doing, and then you could recover revenue in the long run. And that kind of predatory practice is not possible when you have locally owned, controlled, and revenue that's retained within the system. All of the resources that are there in these organizations comes from the federal government as well as Oregon taxpayers. And seeing that it has the potential to being diverted to a corporation in Delaware seems inappropriate and antithetical to what the wellness goals are for the coordinated care organization. I'm going to write a little bit more about this and submit something a little later, but I hope that what I've said is on point.
Thank you for your comments. And somehow you made it exactly 5 minutes. Appreciate that. Again, with just 8 minutes left in this public listening session, we'd welcome any comments or input. Please feel free to share by raising your hand in the chat or sending a message in the chat. Again, if you want to send additional public comments, please do so to hcmo.info@oha.oregon.gov. Those will be posted publicly as well on our website. So we remind you not to share any confidential information in those public comments. So we have just 5 more minutes left on this public listening session. We're really grateful to having heard from everyone who shared their comments with us this evening. We will stay on until 6 o'clock. Feel free to chat us or raise your hand and share your comments publicly if you'd like, or send your comments via email. Thank you, everyone, for participating. Okay, with that, we're going to conclude the meeting. We really want to thank everyone for participating today. We're so grateful to have heard your voices and perspectives. And just as a reminder, once again, this meeting and this morning's public listening session will both be posted. The recordings will be hosted on the HCMO website, and OHA will be using what we heard to inform our review of the Care Oregon Scan Group deal. And we're so grateful for you joining us. Thank you.